So hello, everyone. My name is Cyrena Gluga. I'm the Director of Research for the Preparedness and Treatment Equity Coalition. I'm here today with another one of our fantastic grantees. She'll introduce herself, and we just have a few questions about her work and what drew her to our program. So do you mind introducing yourself?
Sure. Hi, everybody. My name is Monique Gill. I am a research scientist at CORE, which is the Center for Outcomes Research and Education. CORE is an independent team of scientists and data experts based in Portland, Oregon, and we work with a variety of cross-sector partners to examine and address barriers to better health and provide insights that can shape healthier systems, healthier policies, programs, communities.
So what brought you to the field of health equity research?
So I am a mixed methods researcher. My background is in community health sciences. So I was drawn to this field because I'm really interested in health equity and the role that systems and upstream factors play, both in perpetuating inequities, but also the ways that these disparities can be addressed and negative health outcomes can be prevented. So most of my work has been in applied research and evaluation related to the social determinants of health, which are defined often as just the conditions in which people live, learn, work, play. And so I'm really interested in thinking about factors that kind of live in that upstream space and how they impact health. And I've worked across a lot of different topic areas kind of within the social determinants and health equity space, but not exclusively with cancer related research, but the project that I'm going to be talking about today is, I think, a good example of research that links social factors to health outcomes.
Okay. So what kind of populations do you work with?
So super broad. CORE as an organization, I mentioned the social determinants. This CORE focuses broadly on those through a lot of different topic areas. So, for example, we have a lot of work that's around housing and health, collective impact, health transformation. In recent years, we've expanded into some more cancer-related research, and specifically from the lens of equitable access to screening and early detection. So trying to better understand barriers to that type of care. But in terms of population, it's so broad because I think part of the CORE as an organization, we think about opportunity for health being much earlier. That opportunity begins long before illness begins. And so we're thinking about those social factors and how they're driving gaps in things like mammography screening or disparities being drivers of health outcomes essentially. And so trying to understand those conditions and the underlying factors is kind of our bread and butter. So can't really answer your question of population. We work across so many different populations.
So why don't you tell me a little bit more about the specific work that you'll be that we funded your CORE team for?
So this study, overall, our aim was to understand how healthcare experiences contribute to gaps in preventive mammography, and also the extent to which these experiences look different for folks who are included versus ineligible for health system screening metrics. So I'll talk about the first. There's sort of two research questions, and I can talk about each of them individually. So in the first research question, we're looking at the pathways by which two different types of healthcare experiences impact mammography. So we're asking whether experiences of discrimination in the healthcare system and the level of healthcare communication are directly related to being current on mammography, and the extent to which each of those relationships is mediated by perceptions of the healthcare system. So in other words, do experiences and communication shape how patients are perceiving the system, and then does that in turn affect their behavior? And we felt like it was important to kind of disentangle these pathways because drivers of gaps in mammography, or really drivers of any health behavior, are extremely complex. And so kind of having a chance to disentangle the way these factors are related to each other can help us inform opportunities for intervention, both at the individual level, but also thinking about what can the health system be doing differently to improve experiences and reduce disparities. So that's the first question. And then in the second research question, we are taking, so the data that we're using in that first question comes from a large survey that we had done in the fall of 2021. And so in the second question, we're linking that survey data to health system metric data. And we're trying to understand whether experiences look different for individuals who are included or ineligible for the metrics. So health system metrics, just to give a little bit of background, the system uses metrics to assess their performance, to think about populations for targeted outreach, and to also evaluate whether they're meeting quality goals. And so making decisions about who's included in the population for the metric, it's usually going to be based on whether someone has engaged with the system previously. So then implicitly the system is saying, you know, whoever's included in the denominator population is essentially who we're feeling responsible for. So if someone is excluded from the metric, the system is essentially saying, you know, we don't consider ourselves responsible for ensuring that that individual is receiving appropriate breast cancer screening. So naturally, the decisions that are made about who is included in that population, who's ineligible for that population, that's going to impact the disparities that we observe. And so there could be, just like the system could be misled in thinking we're meeting our health equity targets when maybe that's not actually the case because folks are being excluded from the metric itself. And so we're looking at that population of folks who are included versus excluded, and then looking at their survey responses to see what were their healthcare experiences like, to try to understand, do experiences look different for folks who are end up included in that metric versus those who are not. And so ultimately we can maybe hopefully understand a little bit about whether there's some sort of systematic exclusion for folks who maybe need outreach the most.
Well, that was a very straightforward. Thank you so much. Very excellent questions. I think like one thing that I think we can pull out from that is very often organizations look at their data and will say, we're doing a great job. But like, as you pointed out, very often people are not included in that data. And therefore, we're probably not doing as great a job as we think we are. So, like you've said very clearly, this is a really important question for us to answer. So how did you identify this funding mechanism? How did you find us?
How did we find you? I think a colleague of mine at CORE had actually just came across it probably in some sort of email listserv and forwarded it my way, because the survey that I mentioned that we're using for both research questions was part of a different study that was funded by the CUNY Foundation. And so we had, done that survey and done some analysis of that data, but there's a ton of data that we had from that survey. The survey was also informed by some focus groups that we had done prior to that. And so we felt like there was a ton of data there. We'd done a lot of work to get the survey, I think it was sent to 20,000 women across Oregon and Washington. We had about 7,000 responses, and it was done in 5 languages. And so it was really, really rich data, and we wanted to do more with it. And so the PTech opportunity just felt like a really great fit because the timing was right. We had the data. We had a lot of questions about the data, and a lot of the questions aligned with what the Health Inequity Research Grant Program was kind of focused on, and so it all just kind of aligned.
Oh, well, I'm really great. That's great. I'm glad to hear that, because one of the things we were really hoping to do with this grant program was to identify teams just like yours that had, really great ideas, that perhaps had data that they wanted to use to kind of step up to another level, but needed the funding to do that. And so it's kind of a little bit of a starter grant in some ways. It's not a lot of money for of, someone may be getting R01s, but it's a lot of money for a team that maybe needs something to push their ideas forward. So that's really
Absolutely.
great. I'm glad to hear that, and I'm sure, stakeholders will be glad to hear that as well. So can you tell me a little bit about what you're hoping to find in this as an outcome of this research?
Yeah, I think for the first research question, I think really just trying to better understand these experiences and how they're related to each other. So I think recently there's been a lot of attention paid to equity in healthcare systems and those kinds of things. Folks are paying more attention, I think, but being able to have um, some data that points to like, here's exactly how these experiences of discrimination, for example, are related to, excuse me, actual behavioral outcomes. So we're seeing not just kind of anecdotally that having potentially negative experiences in healthcare affect the way people interact with healthcare moving forward, but we can actually demonstrate it through the data. So we're using structural equation modeling to really model out that relationship of how do experiences shape perceptions and how do perceptions then in turn affect behavior. So I think getting some clarity on that is one goal. For the other research question, I think it's a really great opportunity to connect. So with metrics, a lot of times they're seen as somewhat objective, like you were kind of alluding to. They're seen as being this objective thing. But even if we look just at the metric alone and we're saying like we're either meeting this target or we're not meeting this target, it's not telling us anything underlying about why or how or anything from the patient experience. And so just the opportunity to link it to survey data where that's representing basically the patient voice. So being able to kind of see how those things kind of come together will be really interesting with that second research question. But sort of like specific goals, once we have some solid findings, we want to be able to use the results to try to facilitate some meaningful change in how the system's addressing patient care with regard to preventive mammography, potentially provide some recommendations about the creation and the use of healthcare metrics. And CORE, as an organization, we're based within the Providence St. Joseph Health System. So we're tapped into a pretty large system spanning, I think, 7 states, serving over 5 million patients per year. So there's an opportunity just within our own health system to share our research, hopefully drive some changes. But we're also really, really interested in disseminating our findings more broadly. CORE partners a lot with the Medicaid managed care entities in Oregon and the Oregon Health Authority. So both of those are going to be really important audiences for this work.
Well, you answered that very efficiently, and I think that's really excellent that you're already tapped into so many different ways to disseminate your research to the public so that, it's not just in a closed system for academics, but it's actually going to be something, just like you said, to really affect change. And you're closer than some people would be to being able to do that with their results. So do you have any final thoughts that you'd like to share with our audience, whether about the work that you're doing or perhaps about where you'd like to see this program go from here? Anything at all?
I think the only other thing, like you sort of mentioned, is the grant gave us this opportunity to use the really rich data that we have to answer some really important questions. And so one thing that we're really excited about is just being able to speak to system level changes or places to intervene rather than always being individual focused. When we were doing some of our background research, what we were noticing is that a lot of the research around disparities in mammography tends to either stop at sort of identifying and documenting the disparity or focus on kind of individual aspects like maybe gaps in knowledge or perceptions and things that sometimes lead us to think about individual focused interventions as opposed to systems level. And so we're just really excited for the opportunity to think about being a little bit more upstream from there, and what, not just, patient education, super important, raising awareness, all those things are really, really important. But I think that there's things that could be done also at the system level to change and improve the experiences that people are having with healthcare, so that they can be wanting to do their preventive screening and hopefully improve health. So that would be the only other thing to share. But thank you.
Yeah, so I mean, I think you end on a really good point that it doesn't really matter if we make people aware that these are resources available to them if they get to the system and the system doesn't serve them in the way that they need to be served. And that, documenting disparities isn't really enough if we don't do anything about them, and doing something about them requires systemic changes, not just uh, individual level changes. So it was really great to have you here with us today. I think that this is going to be a fantastic project, and I think the rest of my team thought so as well. It's really awesome to see mixed methods research being done, and being done well. I'm a huge supporter of mixed methods research in this field, and so I was really glad to see your project cross our desk, and we'll be looking forward to seeing your results. So thank you very much for joining us today.
Thank you so much for having me.
Right. I'm gonna end now. Oh wait, I want to do that. How the hell do I- You're gonna forgive me for this. This is editing out, by the way.